Hi, I'm Dr. Christoope Palmer. I'm a specialist in robotic total joint replacement surgery. If you've decided that you need a total knee replacement, there's some things you need to do beforehand. Number one, getting into what we call prehab, or physical therapy before surgery. And the reason for doing that is to try to get as much motion as you can in your knee, build up as much strength as possible. Every study shows the more strength and the more motion that you have in your knee before surgery, the better you'll do after. The pre-physical therapy will be done with a physical therapist, someone who can help coach you along. They will measure you before, they'll measure your strength and your range of motion. That way afterwards, you'll know when you get back to your preoperative function and you'll know you're progressing forward. Other things we want to avoid going to the dentist or any other procedure, anything that could put infection into your body before surgery and before we do a joint replacement. We will give you a list as far as what medications you can safely take and which ones you should stop. Some of the ones you should stop for any major surgery, including a knee replacement, would be blood thinners. Those need to be stopped 5 days before. Medications for autoimmune diseases like rheumatoid arthritis or psoriasis need to be stopped for a month before and a month after. Also, if you smoke, we would hope that you would stop smoking, but we would absolutely require you to stop smoking 6 weeks before and 6 weeks after. On the day of surgery, you can't eat or drink anything after midnight that day unless we instruct you otherwise. You'll need to come into the operating room at least 2 hours before your surgery. We'll give you that time either the week before or the day before, depending on where we do the surgery. You'll be greeted by the nursing staff. They'll start your IV, they'll do some paperwork and some blood work as well to make sure nothing has changed since your last labs. After your paperwork's done, then I'll come and see you. I'll answer any last questions you have. We'll mark your leg, and then we will do what's called a block, which will help with postoperative pain control, and a spinal anesthetic, which will help during the surgery to eliminate pain as well as keep your blood pressure low. And then we will proceed forward with the surgery. I know that having a knee replacement is intimidating, but we will take good care of you. This is all we do is robotic knee and hip replacements, and we're happy to answer any questions you have. We'll do anything in our power to make this smooth for you.